Okay, this unit deals with body physiology, how the body organ systems function. It gives a good overview of all the major organ systems and their functions and how nutrition relates to that. The major system this unit deals with, and the major system you're going to see most test questions on, is the digestive system. Obviously, the digestive system plays the biggest role in how we process our food and assimilate it into our body, but we will touch on other major organ systems just so we know that the role that they play in body function, and also how nutrition affects them. So just to give you a little bit of biological background, a lot of you probably already know this, but just to review a little bit, when we look at life and the study of life, all living things are made up of cells. A cell is a self-contained entity that, sorry about that. It's a self-contained entity. All living things have to be at least one cell big. It's interdependent on other cells to supply its needs. When you look at, what I mean by that is when you look at higher level organisms like a human, we're made up of trillions and trillions of cells. And each individual cell is independent, however, it does rely on other cells for communication, for other body functions. The more complex an organism becomes, the more cells will specialize and take on specific roles. The simplest of cells, things like a bacteria or an amoeba, things like that, those are cells and they're considered living beings, and they basically do everything that our body does, just with one cell. But again, the more complex an organism becomes, the more multicellular it becomes. All of those cells still need energy, oxygen, water. They still all produce waste, but they do start to specialize into specific roles. And those roles are really defined by our genes. Our genes are basically what make up our DNA, our genetic blueprint. And a lot of you have heard or know a little bit about DNA. Everybody's genetic code is unique, of course, unless you're an identical twin. But that genetic code is essentially the blueprint to make you who you are. It codes for hair color and skin color and eye color and cell receptors and protein molecules and enzymes and all the things that help make our body function. This picture just kind of shows a little overview of what the cell looks like. Don't worry about memorizing all this. I just like to show a picture of a cell. I believe this is one from the inside of the intestines. Yeah, it shows like the little finger-like projections on the edge of the cell that help create more surface area for absorption of nutrients. All cells will specialize into their role, and so a kidney cell will look different than a liver cell, and those will look different than a skin cell. Again, they all have the same basic components that make them up, but they might look slightly different based on how they function, how they specialize. You know, skin cells will make keratin and melanin, whereas liver cells will be busy making liver enzymes. So they might look a little bit different. You see that in how the tissues and the organs present themselves, but they all have these same basic components. They all have an outer cell membrane which helps regulate what comes in and out of the cell. They all have a nucleus that houses the DNA or that genetic blueprint. And then they have other organelles we call, so very much, a cell is very much like a human in that it has a whole bunch of different structures inside of it called organelles that function in very specific ways. You have a Golgi apparatus, you have a mitochondria, endoplasmic reticulum. These all have different roles within the cell, just like the heart, the kidney, the liver, all are organs within your body that specialize. So again, all these basic components of the cell are the same, but cells will look a little bit different depending on what they actually do. And again, this is, just like I mentioned, again, depending on what they do, what they specialize in, their roles will be different. When you look at a nerve cell, it's highly branched because its job is to intercept and take on sensory information and then send that to the central nervous system. They're characterized by rare division. They don't divide very often, and this is why when we have spinal cord injuries or nerve damage, it's very hard to see people recover from that, whereas skin cells are protective and are constantly being shed, and so we replenish those frequently. Those divide very quickly. Both skin and hair, we all see this. Our hair grows quickly. We got to go get a haircut every few weeks. because those cells are always dividing. Blood cells, they deliver oxygen, and they're constantly being made in the bone marrow. Blood cells, their job of delivering oxygen is so specific that when they actually get to maturation, they actually kick their nucleus out to make more space for carrying oxygen. So again, they will specialize so that they can more efficiently do their roles. And again, the hierarchy of organization, the more complex an organism is, the more you'll see this hierarchy of organization. Some cells, like I mentioned, a bacteria, an amoeba, a paramecium, they're only one cell big, and they're considered an organism. Again, the cell is that basic unit of life, so all you need to be is one cell big to be considered living. But if you're a more complex organism, you'll have groups of cells that will work together to perform a function, and that gives them the title of tissue. If you have a bunch of tissues that work together to perform a specialized task, that will give you the title of an organ. An organ, a lot of people don't realize this, but the skin is actually considered an organ. The skin is the largest organ in your body. The skin is actually made up of a couple different types of tissues. You have epithelial tissue, you have some connective tissue. There's even a little bit of adipose tissue, which is a type of connective tissue right below the skin. So because it has more than one type of tissue, the skin is actually classified as an organ. Other organs, things like the heart, the liver, the kidney, and so forth, they will work with other organs to make up organ systems. When you look at, for example, the cardiovascular system, you have the heart. Sometimes it's called the cardiorespiratory system because it's so interlinked to gas exchange. But you have the heart, you have veins, arteries, capillaries. Again, sometimes that gets classified with lungs. When you have more than one organ that function together, you have what's called an organ system. And all of those organ systems combine to make an organism, such as us. So again, I'm just going to touch on some of the major organ systems, what their major roles are and why they're important to our health, and maybe a little bit about how nutrition influences them. I don't tend to focus a lot on these other than that on the test for questions. So just be familiar with the major parts of that organ system and the major roles that it plays. But the bulk of the assessment that comes from this unit is on the digestive system. So all these systems we'll touch on just a little bit, have a basic understanding of what their role is in the body. But really, the digestive system is the one you really need to know all the major steps of the digestive system and the role that it plays in processing our food and assimilating those nutrients into our body. So with that, let's touch a little on the cardiovascular system. Again, it includes arteries, veins, capillaries, the blood, and the heart. This makes up our circulation. And we need our cardiovascular system for transporting. We rely on that to transport oxygen to our tissues and carbon dioxide away from our tissues back to the lungs. It also delivers the nutrients that get absorbed from the digestive system to those tissues, and again gets rid of the waste products through the kidneys and so forth. Lymph, a very important, often overlooked system, is really another form of circulation. We do have other vessels besides arteries, veins, and capillaries that make up the lymph system. The lymph system is what we call an open circulatory system. What the lymph system does, it does have vessels, but they're not what we say closed. You don't always have lymph fluid within the lymph vessels. Lymph is essentially circulating fluid that gets pushed from the bloodstream into tissue spaces and then eventually gets picked up by lymph vessels and gets drained back into the bloodstream, gets dumped back in to the venous system and gets recirculated back through our what we think of as just our basic circulatory system. But we do have lymph vessels that pick up that fluid that gets stuck in our tissues and drains it back to the heart. A lot of you will see if you've ever known somebody who has had trouble with swelling or edema. It might be a medical condition, it might be due to pregnancy, it might be due to a sprained ankle. When those vessels get torn, it has trouble draining that fluid back to the heart, and that's when you see that swelling. Or if you have some sort of medical condition, that can also, there's certain parasites that can actually block lymph vessels and cause swelling. Google elephantitis on the internet and you'll see what I'm talking about. Some massive, massive swelling, very painful, can result from the lymph system being plugged. But remember that the lymph system is also a circulatory system that helps drain that fluid back to our heart. And again, this just depicts, you can see the blood cells, they always stay inside a vessel. They stay inside the capillary vessels here. So again, that's a closed circulatory system, whereas lymph is open. It's the vessels are not always connected together. They just hang out here in the tissues and pick up excess fluid that gets pushed out from the capillaries into the tissue. But here you can see just capillaries will get tiny enough that they have to go through, the cells have to go through just at one cell at a time, which allows for the most efficient ability for gas exchange and also nutrient exchange. Our respiratory system, again, sometimes it gets classified with our circulatory system or our cardiovascular system, and it's called the cardiorespiratory system, just because it does play such a vital role in getting those gases exchanged at the lungs with the blood supply. The respiratory system includes, of course, your nose and your mouth and your larynx, your pharynx, your trachea, and your lungs. The lungs are the site of where we have our gas exchange between the blood and the air. When you get into the alveolar sacs at the base of the lungs, the air has been saturated with moisture. It's at 100% humidity. It's sterile. The pharynx and the trachea have done their job to filter out any dust particles. If you've ever swallowed wrong or gotten something stuck in your trachea or your lungs, you immediately have that cough reflex to get it out. There's not supposed to be anything in there but highly saturated air. The blood will return to the heart, and the heart will then pump it to the lungs where it gets reoxygenated again and loses its carbon dioxide. It'll go back to the heart, and then the heart will then pump it out into the body. So there's really two actions of the heart pumping. The heart will pump blood to the lungs for oxygenation, and then it'll also it'll return back to the heart. It'll return back to the heart where it then gets pumped out the aorta to go feed the body. So we have both the pulmonary circuit, the circuit of blood going to the lungs and back to the heart, and then the systemic circuit, which is pumping blood to the body tissues and then back again. Arteries pump blood away from the heart. Veins carry deoxygenated blood back to the heart. I always just remember arteries away. Arteries are always pumping blood away from the heart. Veins are always pumping it to the heart. Don't try to remember this as arteries always have oxygenated blood. That's not true. Arteries, the pulmonary arteries, which feed the lungs, are taking deoxygenated blood to the lungs, and then the veins bring oxygenated blood back. So just remember, arteries away. Arteries are always being transporting blood away from the heart, and veins are always carrying blood to the heart. And again, this just depicts what's going on here. You see at the lungs, the lung tissue, this air capillary interface, you can see oxygen will diffuse into the blood, and then once that blood gets to the tissues, the muscles and connective tissues, the bone, wherever it is, that oxygen will diffuse into those cells, and the carbon dioxide will diffuse out into the blood cells. Some carbon dioxide will travel dissolved in the fluid. Some will travel as carbon dioxide within the blood cells. And this is where you see when you get your blood taken at the doctor's office, your blood kind of almost has almost a purplish tint to it. It's very dark. And the reason why is because they're always taking blood from a vein. And those veins carry deoxygenated blood, so the blood will look almost kind of a purplish color. And that is due to the carbon dioxide contact. It's not that bright red, rich blood. If you poke an artery, you'll know right away because you'll have a lot of pressure behind it. It'll squirt out quickly, and it'll have a much redder tint to it, and that's due to the oxygen content. So the next major system, the endocrine system. The endocrine system is made up of all of our glands, our hormones, things like our adrenal gland, our thyroid gland, our pituitary gland. These glands secrete chemicals that cause responses in body conditions. And those chemicals, we commonly refer to those as hormones. Those hormones, those are our chemical messengers. They tell our body to do different things. They help maintain certain conditions in our body. During puberty, certain hormones are triggered to develop secondary sexual characteristics. men, their voice will typically get deeper. Women will develop breast tissue. They'll start their menstrual cycles. Hormones regulate that. Hormones are the things that, those chemical messengers that tell the body to start developing those things, or tell the body to do different things that maintain certain conditions, maybe not necessarily change, but maintain a certain condition. So all these different glands within our body, the thyroid gland, pituitary gland, the adrenal gland, ovaries, testes, these things all monitor different conditions and produce one or actually several hormones usually to regulate it and take the proper actions. And how does that relate to nutrition? Well, one way that it's linked very directly to nutrition is our pancreas. Our pancreas is both what we call an endocrine gland and an exocrine gland. It actually is both part of our digestive system and part of our endocrine system. It secretes different enzymes that are involved in digestion, but it also secretes hormones that help regulate our blood sugar. So, and we'll discuss this a lot more in another unit coming up, but just to give you a little sense of what it does, when you consume a sugary meal, or you have a Mountain Dew and a sugary donut for breakfast, those simple sugars very quickly get absorbed into the bloodstream. And the pancreas will detect that. And when they detect that high level of simple sugars, typically glucose, blood glucose, the simple sugars, just so you know, if you don't consume glucose, if you consume fructose or some other sucrose, maltose, the liver will very quickly convert those to glucose. Glucose is our circulating blood sugar. So that's really what, no matter what refined sugar you consume, it will get converted to glucose rather quickly. And once the pancreas detects that, it releases a hormone called insulin. Insulin is essentially a hormone that is the key to unlock access to your cells. Insulin will stimulate your body cells to take glucose from the blood and also send that excess sugar, that excess glucose, to the liver and store it in the form of glycogen. Glycogen is a complex carbohydrate that is essentially just a bunch of glucose molecules joined together and stored in the liver and also in the muscle for later use. So when you eat that sugary donut, that's how those sugars get into your cells to get metabolized, and that's where you kind of get that little sugar high when you spike your sugars. So throughout the day, let's say you go 2, 3, 4, 5, 6 hours and you haven't consumed anything. Well, over time, as those sugars are getting consumed, your blood sugar will start to drop lower, and the pancreas will sense that. And then it will secrete a hormone called glucagon. Glucagon will stimulate the liver to break down the glycogen back into glucose and release it into the blood. So again, the endocrine system helps us to maintain what's called homeostasis. Homeostasis refers to this internal balance, so that no matter what you're doing, whether you're drinking a Mountain Dew or you have to go to work and you haven't eaten for 6 hours, the pancreas's job is to make sure that your blood sugar level remains constant, so that no matter what is going on in your digestive system, no matter how long it's been since you've eaten, that your blood sugar level maintains constant, so that your tissues are getting access to the right amount of sugars. When the pancreas loses the ability to do this, and there's different ways that it can lose that ability. Sometimes it can be genetic, where it just has a genetic mutation and just can't produce the insulin protein. That's called type 1 diabetes. Sometimes it is environmental or due to habits. Over time, if you're constantly spiking and dropping your sugars and spiking and dropping your sugars and going long periods of time without eating and then eating highly sugary foods, that's very, very hard on your pancreas over time. I describe it like an engine. If you take your car out on the highway and you put the pedal to the metal and drive the car at 120 miles an hour, and then you slam on the brakes and then you hit the gas again and go 120 miles an hour and then hit the brakes, that's what you're doing to the pancreas. You're constantly spiking and dropping your sugars through poor diet choices. It's constantly having this pressure put on it to be creating insulin and glucagon to regulate those sugars. And over time, it can lose its ability to make these hormones. Or the cells, which are supposed to respond to the insulin, which are supposed to recognize the key to let the sugars in, will become what we call insulin resistant. It's almost like they build up a tolerance, like an alcoholic builds up tolerance to alcohol. And that leads to what we call type 2 diabetes. So the best thing to do is don't skip meals, don't go for 6-8 hours without consuming anything, and then down a bunch of simple sugars. The best thing to do is eat small meals every 2 to 3 hours with lots of complex carbohydrates. They're absorbed more slowly, and you don't peak your sugars out quickly and then crash or crater later on. I describe it like the little blue-haired grandma driving on Sunday to church. Slowly accelerate, slowly decelerate, and your engine won't have any problems then. If you keep going to 120 and then slamming on the brakes, eventually that engine, that pancreas, will seize up and not function properly. The nervous system. Again, the nervous system, the major role of the nervous system is to detect sensory information and then respond to it. So if you put your hand on a hot stove, believe it or not, there's a signal that goes to your central nervous system that says, ouch, that's hot, don't do that, and it sends a signal back that says that neuromuscular connection will quickly contract that hand away from the stove. So in an instant, when we do something that's painful, there is a signal that goes to our brain and says, ouch, that hurts, and causes a response. It's so quick, though, that we don't usually recognize it. Usually when people can recognize that nervous signal is when they stub their toe, because there's that moment when you stub your toe where you stub it and you go, oh my gosh, this is going to hurt really, really bad. And then you feel that terrible throb, right? Everyone knows that feeling. And the reason you have that feeling is because your brain actually registers what you just did before the signal travels fast enough for you to feel the pain. When you're going from your toe to your brain and then back to your toe again, there's that little brief moment when you know how bad it's going to hurt, and then it starts to hurt. And so you can recognize, think about that the next time you stub your toe. You're actually, that brief moment when you're thinking about it and waiting for the pain, that's actually the relay of sensory information to the brain and then back to your toe to feel that response. So we rely on that nervous system to take in sensory information and then cause a response. So as much as we don't like pain, we really rely on that nervous system to help us protect our bodies. Our nervous system is made up of nerve cells called neurons. They take in that sensory information and relay it to our central nervous system. Our central nervous system is made up of our brain and our spinal column, and they send back out that information after it's been interpreted. They send it back out into those nerves again, and that extend throughout our appendages, and we call that our peripheral nervous system. So what does that all have to do with nutrition? Well, there are a lot of different things it has to do with nutrition, but just how it relates to how we eat and how we perceive food, there's a very distinct difference between what we consider hunger and appetite. Hunger, by definition, is the physiological need for food. So make sure you understand the difference between these. Hunger is actually where the body recognizes the need for food, for the need for nutrition, and the nervous system is actually involved in signaling to the digestive system to prepare for food or to stimulate you to want to eat. We actually have a part of our brain called the hypothalamus that will work in concert with other hormones and nerves to signal that feeling of hunger. And it's not just a mental feeling. We actually, whenever your stomach growls, that is that rumbling you feel is the smooth muscle contractions around your digestive system that cause peristalsis to happen, or those wave-like motions to help food move around. You're actually feeling that growl as a result of your nervous system stimulating that. The gurgling sound sometimes you hear in your stomach, that's digestive juices being poured into your stomach, getting ready to eat. You're hungry. You're actually physically hungry. So those signals from our nervous system actually stimulate that desire for food. That's very different than appetite. Appetite is the psychological need for food. So make sure you distinguish between these two. I will ask about them. Psychological need for food is not necessarily driven by an actual physical or physiological need for food. Appetite is based on the brain harboring different thoughts, emotions, or experiences that we associate with different foods. And we see this a lot in today's society. People eat because they're sad. They eat because they're happy. Their boyfriend broke up with them, so now they're going to go get a tub of ice cream and watch sad movies all weekend and cry. And, we all do this where we eat to essentially satiate or satisfy ourselves. And there's absolutely hormones linked to this, endorphins, serotonin. There's lots of different hormones that are linked to our eating habits. We release different hormones when we eat high-fat, high-sugar diets. We often see people who have poor eating habits, poor nutrition, struggle with anxiety, depression, other mental issues that drive them to eat. And it's not just people who have issues, mental disorders. We all do it. Somebody dies and there's a funeral. There's food at the funeral. Somebody has a wedding. There's wedding cake. Somebody has a birthday. There's cake. Whether we're happy or sad, whenever we celebrate something, we usually associate food with a celebration. For better or worse, cultural, religious, habit, whatever, tradition, lots of times we associate food with different emotions. So that's what appetite is, that psychological need for food. Very different than actual hunger where we physiologically need it. Our immune system, our immunity by definition, is the ability to protect oneself from microbes such as viruses, bacteria, tapeworms, you name it. Any sort of foreign invader that tries to get into our body, our immune system's job is to protect us from that. We have what's called our first line of defense. These are our protective barriers. These are like the skin. Our body cavities are lined with mucous membranes. Think about your throat, your nose. We make snot, we make mucus. Even your ears make wax. There's all sorts of protective barriers that help prevent those things from actually getting in. And really, our first line of defense is by far the most important. If you've ever seen or heard of somebody who has a severe burn on their body and they lose that skin barrier, they're much more prone to getting infections. Many people who have severe burns often die of infection. So we really rely on those protective barriers. And a lot of those barriers are very sensitive to vitamin deficiencies. So they're very much linked to things like vitamin C comes to mind, vitamin A. Vitamin A and vitamin C play a lot, major roles in skin and tissue integrity. Vitamin E is known as an antioxidant and helps with fighting potentially cancerous cells. Our immune system also helps fight cancer. So getting good nutrition not only helps us maintain those protective barriers, but it also helps to complement the job of our more specific immune system. So once things penetrate our protective barriers, our T cells, our B cells, sometimes they're called T lymphocytes, B lymphocytes, phagocytes, these guys are like little Pac-Mans that go along and engulf debris, waste, bacteria, anything foreign. Antibodies, these are produced by our B cells. These guys are specific to certain types of infections. These guys all rely on good nutrition. If we're not physically healthy, it's hard for our body to make these. B cells are made in our bone marrow. T cells are made by our thymus. They tend to hang out in our lymph tissue after they've been produced, which concentrates under the arms, in the neck, in the groin area. This is why when you have the flu, you feel so sore and stiff in your neck, your groin, and your underarm is so sensitive because these cells are getting cranked out, and that makes those tissues very tender. So when you're feeling your worst when you're sick, just remember that that's probably when your cells are doing their best to fight it. So all that tender feeling you feel is actually a good sign that your body's responding. But if you're not getting good nutrition, those immune components are not being made properly, and they're not being complemented by those antioxidants in your diet to help fight the infection. So those are really some of the major systems. There's a couple other minor ones, but the respiratory, the cardiovascular, lymph, immune system, endocrine system. Those are the major systems and some of the ways they tie into nutrition. And there's other ways too, but again, I'm not going to focus as much on that. I want you to have a sense of the components that make up those systems, the roles that they play, and a little bit of how that relates to nutrition. The big system that I want you to know from this unit is the digestive system. Obviously, the digestive system plays a huge role in nutrition. We rely on it to absorb our nutrients, to break down our food, to assimilate that food into our body, and then get rid of all the waste, things that we don't need through our large intestine and our colon to excrete that waste. So very, very, very major role in nutrition. So my expectation is you know the functions of the digestive system very well, what is happening to our food both physically and chemically at each stage, what's happening in the mouth, what's happening in the stomach, what's happening in the small intestine, how is the digestive system processing all of that food. So focus the majority of your attention in this unit on understanding the digestive system and the role that it plays. So from the moment we consume our food to the moment we excrete the waste, so from mouth to anus, the travel time for our food is about 1 to 3 days, and this varies quite a bit. Some of you guys are reading this going, I have a bowel movement every day, sometimes twice a day, and some of you are reading this going, geez, I only have a bowel movement, every 7 days. This is an average. Typically, the more frequent your bowel movements, the better. If you're not having them very frequently, you might want to look at how much water you're getting, how much exercise you're getting, fiber. Some drugs can affect this. Some health conditions can affect it. So those are all things to consider. But typically, from mouth to anus, your food will take about 1 to 3 days to be completely processed through your system. So we'll begin at the mouth and work all the way down to the anus, step by step. So what happens in the mouth? In the mouth, we see both what we call mechanical digestion and chemical digestion. Mechanical, just think mechanical, think physical. Mechanical digestion is physically breaking down food into small enough pieces that are easy enough to swallow. In my face-to-face classes, I'll give my students a cracker, and I'll tell them to put it in their mouth and try and swallow it. And of course, they can't, because it's got sharp edges, and it's rough, and it's dry, and it's very, very hard to swallow unless you have mechanically digested it. You got to physically break it down into smaller pieces. It mixes with water from our saliva that softens the sharp edges, makes the food slippery and easier to pass through the system. That saliva also contains digestive enzymes. Amylase is a digestive enzyme that actually starts the process of breaking down our food. Amylase can break down complex carbohydrates into simpler carbohydrates or sugars. And this is another little test we do. I make students eat a piece of bread and not swallow it. They have to chew it and chew it and chew it until it's a slimy mess in their mouth. And eventually, it starts to taste kind of sweet. And the reason it starts to taste kind of sweet is because chemically, your mouth is starting digestion. It is chemically altering those carbohydrates into simple sugars, starting the process of making those molecules small enough that they can be more easily absorbed. So try this at home sometime. Put a little piece of bread in your mouth and chew it and chew it and chew it till it's a slippery, wet, gooey mess, and you really want to swallow it because it's disgusting, but really pay attention to how it begins to taste. It will start to taste sweet. You'll start to taste those simple sugars coming through. Really, once we're done in the mouth, all the voluntary actions of eating are done. Once you've swallowed your food, everything else from then on out is pretty much involuntary. It goes you got a one-way path now after swallowing it to move it from your esophagus down to your anus. With the exception of vomiting, which is another really involuntary reaction, the gag reflex is typically involuntary. Food goes one way. If you stand on your head and you swallow that cracker, the food is still going to go down that tube, even though it's fighting gravity. And that's due to a process called peristalsis. Peristalsis is the wave-like muscular contractions of the digestive system. Our entire digestive system is surrounded by circular rings of muscle called smooth muscle. And that smooth muscle, we can't control it, not like bending our arm. We can control the muscles in our arm. That's called skeletal muscle. But the smooth muscle that surrounds our digestive system is involuntary. It will constantly be squeezing food in that one-way pathway. It's kind of like putting a marble inside a rubber tube. The rubber tube is always going to squeeze that marble going in one direction. and that keeps our food processing the right direction. So that mass of food in the mouth before you swallow it, it's called a bolus. So now we don't really call it food anymore from this point on. I might refer to it as food, but really, once food has been mashed up and partially digested in the mouth, that's called a bolus, and then it gets swallowed and goes into the stomach. And again, I mentioned earlier, chemical digestion, we start to see breakdown of carbohydrates. There's a little bit of fat digestion, but really not much. It really, I mention this here because we will see this mainly in infants and babies. They have the ability to digest that fat. Again, think about the role of what babies are doing. They have typically a higher fat diet, and all they're doing is growing. That's their job. And so they want to get that fat digestion going right away. So typically by the time you become an adult, you're not doing any fat digestion in the mouth anymore. That's why I say it's really minimal, and it's really just in children. But we don't see any protein breakdown until the stomach. When you bite into that steak or that hamburger, you're really just doing mechanical digestion. You don't actually chemically digest any of your proteins until the stomach. So once you swallow that food, like I said, it's everything from then on out is involuntary. And here, this is a picture, a sagittal, partially mid-sagittal section here, and then a frontal section, so you can kind of see what's going on with your digestive system. Here's your mouth. These little white things here are your teeth. This big dark pink thing here, that's your tongue. So when you swallow your food and it comes down here, this little flap of connective tissue with some cartilage, this is called your epiglottis. That little flap, when you swallow right now and feel your throat, and you can feel the little lump, the little gulp. You see this better on men because they have a more pronounced Adam's apple. But when you feel that gulp, this little flap of tissue is coming down and covering the glottis. The glottis is the opening. The epiglottis is the flap of tissue that covers the glottis. The glottis is the opening that leads into the respiratory system, leads into the trachea, and then feeds the lungs. So this prevents any food or liquid from getting into your respiratory system. And every time you swallow, you feel that little lump. That's because this tissue is flipping forward and covering that. So the food and liquids travel down from the mouth to the stomach through what's called the esophagus. The esophagus doesn't really have any function in digestion. Its role essentially is really just transport. It transports food from the mouth to the stomach. But we can see issues with the esophagus when we eat really spicy foods, or there's a little ring of muscle here called a sphincter muscle that helps prevent backflow of food from the stomach into the esophagus. If that doesn't close all the way and acid comes up in here, you can get what's called heartburn. It feels like it's in your heart, but it's really not. It's in your esophagus. Indigestion, acid reflux disease, all of those are symptoms of acid coming back up into the esophagus. But they get different names because of the different reasons that they're caused. If you just naturally don't have a good sphincter muscle here, you might get diagnosed as having acid reflux disease. If you just eat a huge meal, spicy meal, and your stomach is overstretched, you might feel heartburn, those types of things. But really, the esophagus is just really a pathway to get food into the stomach. Once food is in the stomach, that food is now called chyme. I know it looks like chime, but it's actually pronounced chyme. Chyme is this thick, liquidy mash that really, this pasty stuff where fat is starting to separate out. The fat typically floats towards the top, and it's this liquidy paste kind of, and doesn't look anything like food anymore. Anyone who's thrown up knows that. So we call that chyme. And when you look at the stomach, it's very, very acidic, which, again, that's when that acid comes up into the esophagus, it burns. But it doesn't burn the stomach. And the reason it doesn't burn the stomach is because the stomach is coated by a thick coat of mucus that protects it from that acid. And then also, again, you have a sphincter muscle here, which is just a circular ring of muscle. That's called the lower esophageal sphincter. And then you also have what's called the pyloric sphincter. Those help keep the food, the chyme, in the stomach, and also the acid in here, so that it doesn't burn the tissues. if you would have a hole in that mucus, and that acid can get to the stomach lining, that results in what we know as an ulcer. And anyone who's had an ulcer or knows someone who has an ulcer knows they're extremely painful. They can cause bleeding, they can cause nausea, vomiting, make it hard to break down your food, they can lead to weight loss. Lots of different things can contribute to ulcers. We do know that H. pylori, which is a bacteria, plays a huge role in the development of ulcers now. There's other medical conditions that can cause it. So lots of different things that can lead to them, and lots of different treatments out there. You can see all these little ridges within the stomach here. Those are called rugae. Rugae are these deep folds in the stomach that allow the stomach to expand when it's full. When it's fully expanded, it can hold up to a gallon of volume, which is quite a bit. So that's a lot of volume your stomach can hold. When somebody has gastric bypass, well, there's a couple different ways you can do it. You can have the what is referred to as the lap band surgery. Whoops. The lap band surgery actually puts a band around the stomach so that it's harder to expand the stomach, so it makes you feel fuller sooner. Some people will actually cut out part of their stomach in what's called the typical gastric bypass surgery and reconnect the lower part of the pyloric canal up higher in the stomach and leave out a chunk of their stomach. So pretty major procedures. Surgery is serious, but also being significantly obese is also serious too. So a lot of people who are having trouble losing weight are starting to opt for some of these more drastic procedures because the long-term consequences of not having them done is much more dire than having them done. But with the gastric bypass, that's a permanent procedure, cutting out part of your stomach. Lap band surgeries, again, you just put a band of plastic around your stomach. Those can be loosened and eventually taken out too. So in your stomach, let me go back a little bit. I want to talk a little bit more about this. So in your stomach, you have really an acidic environment. That acidic environment allows many of the different enzymes that are dumped in there by the pancreas to start breaking down the food particles. The highly acidic environment allows for us to unwind the proteins, or what we call denature them. We actually physically change their shape. Acids are great at denaturing proteins. And then we start to see some fats getting broken down, protein getting broken down, carbohydrates get digested more. Still a lot of just adjusting of the molecules. We still don't see any real absorption of nutrients. We're just still kind of treating our food. We're still kind of adjusting it into smaller bits and pieces so that we can assimilate it later on. The place really where we see the bulk of digestion and absorption occur is the small intestine. The small intestine could be argued to be the most important organ of the digestive system because this is really where we see the final breakdown of all of our major molecules and the majority of the absorption of all those molecules as well. Probably about 90% of all of our nutrient absorption actually occurs in the small intestine. So it's nothing to sneeze at. It's a very, very important organ. As much as the stomach and other organs play a role in digestion, the actual final breakdown of our food particles and the absorption occurs in the small intestine. The small intestine connects the stomach with the large intestine, and it's named the small intestine because it has a small diameter. If you look at the tube, it's a narrower diameter than the large intestine, but it's actually bigger. It's actually bigger than the large intestine because it's just so long. If you were to take your intestine out, or your small intestine out, and stretch it out, it would stretch 18 to 20 feet on average. For reference, those of you that play basketball, from the ground to the edge of the basketball rim is 10 feet. So your intestine could probably stretch from the ground to the rim of the basketball hoop and then back to the ground again. And in autopsies in cadavers, they've actually seen small intestines as long as 33, 34 feet. So again, go to the rim, back to the ground again, and then back to the rim again. That's a lot of intestines in that little space all cramped in there. But we need all that. We need all that space, all that surface area for absorbing our food particles. The first section of the small intestine is called the duodenum. The duodenum receives bile from the gallbladder And the gallbladder is essentially a storage organ that sits just underneath the liver. The liver makes bile, and the gallbladder stores it. And when you eat a highly fatty meal, that bile will get shot into the duodenum from the gallbladder to what we call emulsify fats. Fats don't like to mix with water. Anyone who's cooked in their kitchen sees oil will bead up in your pans when you have water in them. And if you want to remove oil from your dishes, you can't just rinse them with water. You have to use soap. And soap is very much like bile. It's an emulsifier. And it allows us to mix fats and oils with water. So we have to absorb fats into our diet, or we have to absorb lipids into our diet, into our bloodstream. And we're not going to get those mixed in unless we have a way to emulsify them or to mix them with water. And bile does that. So again, don't get that mixed up. A lot of students will mix this up. The liver makes bile, but the gallbladder stores it. So if you have gallbladder surgery and you have your gallbladder removed, and some of you may have known someone who's had their gallbladder removed, or maybe you have as well, that doesn't mean you can't eat fat anymore. It's just you typically try to stay away from extremely fatty meals because you don't have that extra store of bile. The liver will still make bile, and so you can still emulsify your fats. That bile is added in that duodenum, that first part of the small intestine. Also, a substance called bicarbonate is dumped in there from the pancreas. That helps to neutralize the stomach acid. Bicarbonate is the same substance in, your Rolaids or your Tums. You know, when you take an antacid, when you have indigestion, typically the active ingredient in those, look at the label sometime. It typically is a sodium bicarbonate. Our body actually makes that as well to neutralize the stomach acid as the chyme is now leaving the stomach and going into the small intestine. And there's also some enzymes in the duodenum that continue the digestion of food molecules. So really, again, like I said, this is probably the most important organ of the digestive system. What you see when you look at the small intestine, when you expand it out here, you can see all these little folds in here. If you expand those up, you can see there's all these little ridges in here. These are called villi, these little ridges. And even within these little ridges, you see even tinier little ridges called microvilli. And look, all these little microvilli have little capillaries that run in here. This creates a tremendous amount of surface area by having all of these little ripples and all these little villi and microvilli that are highly branched with capillary beds to allow for maximum absorption of nutrients. So you have all of your food particles now are really broken down, and anything that's left to be broken down, the small intestine can do. Like I said, there's still some enzyme breakdown occurring. So your fats and lipids are now broken down into basic glycerol and fatty acids. Your proteins have now been broken down into basic amino acids, and your carbohydrates are now in the form of simple sugars like glucose and fructose. So all those have been broken down, and anything that's left is finished. And then all these little villi and microvilli absorb all these little smaller molecules into your bloodstream. And so because of that huge surface area, we're able to get all the nutrition that we can out of the food that we consume. Once we're done absorbing all of that in the small intestine and it gets into the bloodstream, it goes off to our tissues, where our tissues and our cells essentially use it to do proper body function. What is left over now is not much. Basically what's left is fiber, which is an undigestible carbohydrate. We don't have the enzymes to break down fiber, so that it gets left over and helps make up our feces. There's other non-digestible substances. Every once in a while you'll see something pass that you could digest but maybe doesn't quite get broken down. Every once in a while you'll see a little piece of corn or a seed or something that comes through your fecal matter that could have been absorbed but it wasn't. Sometimes some different drugs or preservatives in food they'll pass through as well. Again, any non-food substance or things the body cannot break down, this is what's left at this point. So the colon basically pushes the rest of that through, and the major roles of the colon, not only to help pass that non-digestible stuff, but also to absorb water. The colon, or the large intestine, this last major organ here. So all this inner blue stuff here, that's small intestine. Here's the colon. We call this the ascending colon. Here's the transverse colon, descending colon, and the sphygmoidal here, this little S shape. And then it goes into an up and down arch here. And this is what we know as your rectum. So all this thicker stuff here, that's your large intestine. And again, sometimes it's called your colon. And its job mainly is to continue passing all the undigested material to make the feces. It absorbs water back into our system. We notice when we're sick and the body's trying to remove itself of anything that's toxic or foreign that might be making it sick, the large intestine will actually release more water into your digestive system. It won't resorb it. And as a result of that, that's when you get diarrhea. You get those really watery stools because the large intestine is basically using its power to not reabsorb water and try and flush out your system if you're sick. So that's where we see those watery stools or that diarrhea from when you're sick. Also within the large intestine, we do see, there's some natural bacteria. We call them natural flora of our body. There's, once we're born, bacteria will get into our system and colonize our large intestine. And they're actually very important. They keep each other in check, and so they don't make us sick because they're all competing with each other. So not any one gets a hold of us. And a lot of those bacteria also make different vitamins, B vitamins, especially K. Vitamin K is a big vitamin that our body makes. That's why it's very rare to ever see a vitamin K deficiency, because there's bacteria in our gut, in our intestine, that actually make it for us. So we make some vitamins, we reabsorb some water back into our bloodstream, and then we pass all this fecal matter out to our rectum where it is later excreted. So a lot of people think, well, why is any of this really important? Why do we have all these non-food substances that we have to get rid of? Well, they're actually very important. We need fiber. We need undigested materials because remember that your digestive system is essentially one gigantic tube, and it has muscles that surround that tube that squeeze against it and push the foodstuffs through your system. If you don't have any non-digestible stuff, imagine if you were just constantly squeezing a tube tighter and tighter and tighter. It's going to lead to whatever's left is going to be extremely hard, extremely painful to pass. And so having a high fiber diet is a very important thing. Even though you don't actually digest the fiber, having it in your digestive system, creates the bulk for which, against the muscles can work to keep things moving along. So that fiber also holds on to a lot of water. It's a very soft carbohydrate. It helps to make your stools or your fecal matter very soft, very moist, and so that it can quickly get processed through your system and eliminate waste. You want your digestive system to run smoothly, to be constant, and to not get plugged up or slowed down or create really hard fecal matter. That can contribute to bowel irritation, irritable bowel syndrome, colon cancer, and just even constipation, which is no fun. So very important that we have that fiber in our diet. Some intestinal challenges, I mentioned a couple of these. Constipation is infrequent bowel movements. It can be caused by a lot of different things, but typically poor diet, inactivity, dehydration, certain medications. Chronic constipation is associated with a higher risk of colon cancer. So very important to make sure you're getting enough water and that you're getting enough fiber in your diet because it is important to your health. Diarrhea is just the opposite. This is where you have loose stools. Can be caused by diet or stress. Typically, most people see it with illness. Typically, when people have loose stools, they usually see it as a result of having some sort of illness. And this is why it's so important when you have the flu or some sort of illness. The doctors will always tell you drink lots of fluids because you're usually losing a lot of fluid through that diarrhea, and it can quickly lead to dehydration and mineral imbalances because you're not absorbing those minerals and vitamins through the intestines. And a hernia is where part of your intestines have actually broken through the abdominal cavity. You have a lining, a thick lining of what's called fascial tissue. It's like a connective tissue that kind of holds all your abdominal organs in place. And if you have a break in that lining, the intestines can actually protrude through there. And when they do that, that can cause a hernia. Those can get obstructed or blocked as a result of getting twisted outside the abdominal cavity and can cause food to back up into the esophagus, make it hard to for your digestive system to work properly. So hernias can be very serious things. Polyps, these are abnormal growths that occur typically on the large intestines. You can see them other places, but usually we see them on the large intestines. Again, they can be removed surgically. Some of them are just benign, but they can be cancerous. But again, polyps tend to be found more in people who have low fiber diet. So having a high fiber diet reduce the risks of polyps and reduce the risk of colon cancer. Again, when you look at, next time you go to the bathroom, look at your feces. Again, that is waste material that is in your body. You want to be constantly moving that through your body as quickly as possible. Look at that toilet and think, oh my gosh, that's been sitting inside me for how long? Those things are irritants. Those things are waste, and you don't want to be keeping it and storing it in your system any longer than you have to. So being constipated can be very hard on your system and can contribute to all sorts of problems, from irritable bowel syndrome to chances for cancer. Finally here, colostomy. When somebody might run into issues with rectal cancer or anal cancer, and if they have to have that removed or treated, or they have some sort of like a Crohn's disease or ulcerative colitis, sometimes the intestines can get so inflamed that they don't function properly anymore. And if you don't have your rectum and your anus, you can't remove waste. You can't remove waste the normal way. So you'll end up getting what's called a colostomy bag. A colostomy bag is a plastic bag that gets attached to the side of your abdomen that essentially is a reroute of the end of your intestines and catches the feces that normally would get passed through your rectum and your anus. A lot of my students are going into nursing or maybe already working in the healthcare field somewhere. You see these more frequently if you're working in the healthcare field, or you hear about it more frequently at least. A lot of you maybe have never heard of it before, but if you are going into the healthcare field, chances are at some point in time you'll take care of somebody with a colostomy bag. Again, as people age or get cancer, different reasons they'll need to maybe reroute their digestive system. Sometimes this is temporary, sometimes it's permanent. It really depends on the condition of the patient. And again, finally, just to touch back on the end here, the rectum and the anus, the final act. So what's going on as the colon or the large intestine, as all that fecal matter is building up and storing itself in the rectum. The rectum is really just the last 20 centimeters or so of that large intestine. It's the last vertical piece of the large intestine, and it opens up into the anus. And again, the anus is essentially another sphincter muscle. This is a cross-section of an anus, and you can see all this little pink stuff here. That is muscle that's been cut into. There's circular rings of muscle that surround that opening that close tightly and then are relaxed when you're having a bowel movement. So the rectum opens into the anus, and that's our outlet or our pathway or our exit out of the digestive system, or sometimes it's called the alimentary canal. That's another name for the digestive system. And this is where defecation or removing of those feces occurs. Really, if you're eating healthy and you're doing it right, it's involuntary muscle contractions that really cause those rectal muscles to contract and the anal sphincter muscles to relax. When you have that sensation, oh, I gotta go to the bathroom, what you're really feeling is the act of peristalsis slowly building and building and building more and more fecal matter in your rectum. And so you feel that sensation that you have to go to the bathroom. That's what you're feeling. You're feeling that buildup of pressure in your rectum from fecal matter building up. And if you're doing it right, if you're eating healthy and exercising and getting lots of fiber and water, going to the bathroom should not be a difficult feat. It really is a process of relaxing. You're relaxing your anus muscles and then just letting peristalsis do its thing. You pass some feces, sit there a little bit longer, a little bit more feces will come down. You shouldn't have to strain. You shouldn't have to get on the toilet and really push hard. The process of peristalsis, moving nice, moist fecal matter that has lots of fiber in it, should naturally occur without a lot of strain. If you go to the bathroom and find that you're straining a lot, even if you don't really feel constipated, but you really feel like you're pushing a lot, something's wrong. You really should work on getting that fiber increased, getting that water intake increased. It shouldn't hurt to go to the bathroom and remove those feces. So if we were to have a nice lab class with nutrition, I'd probably have you dissecting some feces. Wouldn't that be fun? Oh man, good thing it's a non-lab science, right? When you look at feces, it's basically made up of water and fiber and some bacteria. Really, about 75% of the feces material is water. And you notice this if you've ever taken your dog for a walk and someone else didn't use the pooper scooper for their dog. Once that fecal matter from that puppy sits there long enough, it really shrivels up and there's not much left. Water is quite a significant component of actual fecal matter. And once fecal matter is dehydrated all the way, it doesn't seem like there's a whole much left. But the solid portion that does remain is mainly fiber, anything else that's not digestible, and bacteria. Bacteria are really what cause the smell of our fecal matter. They really are responsible for the odor. The gas that we pass is usually a byproduct of different carbohydrate digestion, a lot of vegetables, a lot of beans. When we digest the carbohydrates in those, we produce mainly what's called methane gas, which is what causes our stinky farts. But the actual stink of the fecal matter is usually caused by bacteria. Sometimes hydrogen sulfide gas gets produced too. That's a byproduct of some protein breakdown. Almost smells kind of like stinky eggs, rotten eggs. That's another gaseous byproduct from digestion. But those odors that we smell from gas typically come from our metabolism, whereas the odors from the fecal matter come from the bacteria. Bilirubin is a byproduct of breaking down the hemoglobin within old dead red blood cells, and we also see oxidized iron. Those things, those compounds and molecules contribute to the brown color that we see. Biliverdin is another stage of breaking down old red blood cells. So when you see the yellow in your urine and you see the brown of your fecal matter, that's actually a byproduct of really recycling old blood cells. I mean, when blood cells break down over time, they kind of go through all these different color stages as we break down those molecules, and that's how we excrete them. This is why when you get a bruise, you have blood cells that get damaged when you damage tissue, and the bruise will maybe start out as a dark purple color, the color of those deoxygenated red blood cells, but you see a bruise go through all sorts of color changes as it's healing, and you'll see the greens and the yellows and the browns of the bruise, and that is a direct result of the breakdown of the hemoglobin within your red blood cells. And those same colors are what contribute to both our urine and to the brown color of our feces. So that's what feces is made up of: water, some non-digestible solids, fiber, and bacteria. I like this chart because it's a nice summary of what is happening with all of our major molecules that are going through our system at each stage: at the mouth, at the stomach, the pancreas, the liver. Talks a little bit more specifically about some of these what we call accessory organs: the liver, the pancreas, the gallbladder. Food doesn't actually pass through the pancreas, the liver, or the gallbladder, but these are all attached to our digestive system through different ducts and play major roles in that digestion. And then the large intestine, or the colon, again, tells you what's going on there with all of these different food substances. So this is kind of a nice little chart to help you review. Just break it down by where you are. Am I in the mouth? Am I in the stomach? Am I in the large intestine? What's going on there? Is there physical digestion? Is there chemical digestion? Is there absorption? What's happening with the waste? What are the byproducts of this? Go back and review what's happening at each major organ system and what we're processing there as far as our different nutrients. Because I will, like I said, I will focus more on the digestive system more than any other system in understanding nutrition. I just want to mention real quick the urinary system. Haven't touched on this one yet, but still a very important system. All of the food substances, the liquid, the food, the solid substances you consume, those all pass mouth to anus. The urinary system is an excretory system, very much like the end of your digestive system is, except the urinary system removes metabolic waste, and it's not actually part of your digestive tract. So the urinary system and the digestive system are two separate systems. They both secrete wastes, but the digestive system secretes the solid waste of your digestive process, of what you've consumed for food. The urinary system secretes liquid and metabolic wastes that are a result of different metabolic processes at your tissues. So blood gets filtered through the kidneys, and in the kidneys, the blood will release its byproducts from metabolism. Mainly urea is the major product that it releases from protein metabolism. This is a waste product that is highly toxic to us in high concentrations. Even there's forms of this in birds and other animals, like uric acid, ammonia, that are highly toxic to us. But other animals, like reptiles and birds, they concentrate their waste, and so that they don't need as much water. We can't do that, but again, we don't fly or live in deserts without shelter. So if we had uric acid, we would be in big trouble. That's much more toxic than urea. Ammonia, which is another product close to urea, we produce a little bit of this, but we really do convert most of it back to urea, which is not as toxic. Ammonia is how fish excrete their waste, but they have the advantage of, it's a very toxic substance, but they're in water. So they have lots of fluid to flush that ammonia out of their system. So we kind of settle for urea as our byproduct of protein metabolism. It's dissolved in water, and it's not as toxic as some of those other ones. Collected in our nephrons, which is the basic functional unit of the kidney. We have about 1 million nephrons per kidney that filter our blood. So urea, excess salts, different ions, water, those things all concentrate in the kidney and get stored in the bladder, and that essentially is what makes up our urine. So urea, salts, water, that basically is the urine that we see. And this is why if you smell urine, if it's really strong, it smells kind of like your pine sol or your cleaners under your sink, because pine sol typically has ammonia in it. Of course, they scent it with pine, so it doesn't smell so bad. But that strong ammonia smell when you smell different household cleaners, the reason that smells very much like strong urine is because they have very similar compounds in them. The ammonia in our household cleaners is much like the urea that we excrete in waste. So the kidneys, they basically get rid of our liquid and our metabolic waste. Kidneys also regulate sodium, which is a vital part of controlling our blood pressure. Sodium and water are often kept in balance, and high sodium diets over time will result in retaining more and more fluid, and that fluid is part of our circulatory system. If you have more fluid in your circulatory system, that's going to increase the pressure within those vessels, and thus have a direct impact on blood pressure and the chances of high blood pressure, or what we know as hypertension. So kidneys regulate sodium, but over time, high levels of sodium will put strain on the kidneys, and they will resorb more water and increase blood pressure. Just a little bit about alcohol. I get a lot of questions from students about what is alcohol and why is it so potent. Alcohol does have calories. It basically is a sugar. We make alcohol from anything, like grapes, we get wine, potatoes make vodka. A lot of the different wheats and barleys make our beer. So it's the carbohydrates within those different grains or fruits, vegetables, whatever, that we ferment into sugar alcohols. So we do get energy from alcohol, but the thing about the structure of alcohol is that it can be directly absorbed across the stomach into the bloodstream. And so if you drink a lot of alcohol or high concentrated alcohol, especially on an empty stomach, it can get you drunk pretty fast, because it gets absorbed so quickly. Anyone who's ever taken a shot of hard liquor on an empty stomach knows what I'm talking about. So this is why all good things in moderation, right? Small doses of alcohol, low alcohol content. Drink it with a meal over a long period of time. and in moderation. And alcohol is not such a bad thing, but excess drinking of alcohol on an empty stomach will have some pretty strong effects on your body. What's also happening with your body, besides that direct absorption and instant feeling of drunkenness, is that it results in increased water excretion by the kidneys. So the kidneys will be triggered by alcohol to release more water. So you very quickly get dehydrated when you're drunk. And that also can lead to constipation. Again, if your water levels are low, you're going to have less water in your fecal matter, which can make you more constipated. Again, the absorption can be slowed by consuming food, but really that sensation of a hangover is caused by several different things. It's typically a result of both the toxicity of the alcohol to your body. When alcohol is getting broken down, it can go through different stages, very similar to like a formaldehyde compound, which doesn't make you feel good. And you're also struggling with dehydration. Dehydration also contributes to that hangover effect. And there is no cure for a hangover. As much as people say, oh, take 2 Tylenol and drink lots of water, those are, prophylactic measures. They help ease the pain, but to actually get rid of the toxicity of alcohol, you need time. You need time for your liver to detoxify those alcoholic compounds and process those aldehyde compounds that result. Water can help with the dehydration effect. Tylenol can help with the pain, but you don't get rid of a hangover by taking some magic pill or the hair of the dog or whatever they say. Those things may make you feel a little bit better, but you're still not technically over the hangover. The toxicity is still there, and you need time to pass for that to for that to go away. So with that concludes this unit. Again, focus on knowing in general the major functions of each of those systems that I covered, the major organs and tissues that are involved in that system, and just again in general how nutrition plays a role with those systems. The major system to know from this unit is the digestive system. I will be much more specific on what is happening at each stage of digestion, why each organ within the digestive system is important, and the roles that it plays in processing and assimilating our nutrients from our food into our body.